Welcome, everyone. Thank you for joining us today for our interview with Jan Guenther, local leader, mentor, and businesswoman. Today's presentation has been produced by an alliance between members of the Minnesota chapters of Physicians for a National Health Program and Healthcare for All Minnesota. The purpose of this joint committee is to provide virtual learning opportunities during the COVID-19 pandemic, share facts about healthcare options and opportunities through different formats of interactive learning, and ensure transparency about Minnesota's healthcare shortcomings and opportunities for change through real talk from real neighbors. Our motto is patience before profits, and we're so glad you're learning with us today. Today's event will be the first in a series of local interviews called Our Healthcare Stories. We will be discussing the common frustrations of our current healthcare system and how we can move forward by helping our neighbors. Today's discussion will be hosted by Carol Engelhardt. Carol is a retired nurse and board member of PNHP Minnesota. The final third of Carol's nursing career was spent as a diabetes case manager, which further inspired her passion for making connections with patients and hearing their stories. And today we will be welcoming our guest and friend, Jan Guenther. Jan's athletic background was focused primarily on racing triathlons, cross-country skiing, and organizing events for both of those sports. Jan is the owner of Gear West Ski and Bike, and she began her business life after graduation from college at Duke University as a financial analyst. After completing her MBA at the Kellogg School of Business at Northwestern University, Jan started Gear West in 1991. Today we will learn about Jan's recent battle back from a broken leg, canceled event and travel plans due to COVID-19, how the pandemic has affected her as a small business owner, and her dramatic experience of navigating healthcare costs and options when her husband became ill. Let's begin our Lunch and Learn chat with Ms. Jan Guenther and retired nurse Carol Engelhardt.
Thank you for the nice introduction. I am passionate about all people having health care, and I am passionate about staying well and healthy. And I've asked Jan to join me as my friend and mentor because she's this great example of many things. But also, I want to congratulate you, Jan, that you won the Winter Triathlon March 1st of this year. And you beat out two women that were much younger than you. So that's quite an accomplishment. And I want to ask you what it was like to go from winning this triathlon after having a bike accident where you injured some ribs and you broke a leg, and then coming back to do that and placing first in your age group with the American Birkebeiner, which, if people don't know that, it's this huge ski race of all events and abilities and elite athletes in Hayward, Wisconsin, that 9,000 people ski. So if she beat out everybody in her age group, that's still very, very amazing. So Jan, would you tell us a little bit about this?
Well, hi everybody. Yes, I encountered my first real massive health setback last summer, actually right on my 60th birthday. I had to go in for surgery. I hit a pothole going about 25 miles an hour on my race bike and flew 42 feet and broke my ribs, about 5 of them, 4 of them on landing, and had a compression plateau fracture on my tibia. So I had quite convalescence for 3 months and encountered a lot of healthcare challenges. But coming back was another challenge and something that just took a long, patient road. And with cross-country skiing, I ended up being able to build the strength in my legs and to compete. And I feel lucky to been able to enjoy the winter like.
Okay, and then how was it to go from the World Cup, preparing for that, and Born Dolly was supposed to come, and you were preparing for that, and then this COVID-19 came through to just like a big storm.
Yes, it sure did. It was an extremely challenging situation. I look back, just like one takes a look at anything that sort of changes life instantaneously. I don't think I'll ever forget that day when everything I call stopped. Prior to that, I was hanging around in my cabin right after the Berkey, and I was going to go on my first trip after a year of sort of being injured, and was going to fly through Milan, Italy to ski at the World Masters Cross Country Ski Championships. And I noted, and we were discussing, gosh, there's 300 sick people in Milan, and they're talking about maybe shutting it down. And lo and behold, within a week, they shut down the trip. Then they were going to shut down, or planning to shut down Bjorn Dali, of which he's pretty much one of the great skiers, cross-country skiers of our time. And we were going to bring him into the World Cup that was going to happen at Worth Park, just outside Minneapolis. And we heard rumors that he might not come. And then we found out he wouldn't come. And then we were still setting up for the Worth Park event on Wednesday. And Wednesday afternoon, everything was canceled. I was so stunned. Thursday, I left the store and helped everyone take down what we set up. When really hired a person prior to everything shutting down, and it was really a sort of a jaw-dropping time.
And then also the next week, I know we don't want to spend a lot of time belaboring, but for those who don't know this, Jessie Diggins from Afton, Minnesota is our very own Minnesota Gold Olympian. And she was supposed to be skiing in this along with many other elite athletes. And I noticed, as a social distance properly way, a few of you went out and celebrated skiing with her because she was here anyway.
Yes, she came to a beautiful weekend following what would have been the event. And it was a sunny day, and everybody just tried to support what we knew would be a very challenging time at Worth Park, and all the effort they had spent over 2 years trying to get this World Cup up and going. And we just embraced one another and our health, and skied and enjoyed the sport we loved.
Okay, thank you. Thank you so much for sharing this. You know, Jan, right now I would really like to thank you for being a leader and a mentor, along with other ski trainers in my life, like Cindy Swift and Bobby Hewitt and others. And this last year, I got second place in Ski for the Cure. It wasn't quite as spectacular as yours, but I was pretty happy with it up in Mora. And I would like to know, would you please share with us how your business been affected by the pandemic? And I would like to also tell you, when I've been telling people about this, everyone says, oh, I love Jan Guenther. She's such a team person, and she always wants to help everyone do their best. So when I was looking for pictures to put on our presentation, it was really hard to find individual pictures because you're such a team person. But if you could explain to us how it has affected Gear West and what you look at a small business going forward with COVID-19.
Well, unlike many small businesses, I think we all have our own story depending on our uniqueness. What I love about my business is I chose not to have multiple stores or multiple locations. We have a couple different stores in one location, and I just really enjoy getting to know all my customers, because everyone brings together a story. Our story is and probably the most challenging thing I've faced of owning a business. I've owned Gear West for about 29 and a half years now, and another business outside Chicago for 7 years. And I mentioned I could just throw away all my marketing books from graduate school and everything else and toss them out the window, because it's really uncharted territory. What to do with parts of our business that was yanked out from under us. We just had to close the doors, our Alpine store, our Run store. Our bike business is booming in a very narrow sector of bikes, which is actually really exciting to see. We are not selling race-oriented bikes, or we're not supporting any triathlons or running races because everything has been shut down. But the family business has been really so enjoyable, rewarding to support, and to see families coming in with their children and learning how to either ride a bike for the first time, or parents taking their kids out because they're not driving them all around. It's I've trained or really directed all our resources towards supporting that and hoping that we can get enough product to sell in that one narrow area. Otherwise, the rest of our business is significantly down, and we're just trying to gauge. I'm trying to gauge the fear of our customers and also the fear of our employees, and trying to match and support everyone along that continuum.
Well, thank you for sharing that. And I want to back up a little bit. in February, my husband wanted new skis. And so I said, well, we need to drive out to Gear West because they have the best selection and best price in the Twin Cities. He said, do we have to drive out there? Can't we find anything closer? And I said, no, we're going out to Jan's store, Gear West. So we did. And I asked one of your employees if I could visit with you. And you came down because one thing I'm impressed about, you'll always spend 5 minutes to connect with a friend athlete or a citizen athlete like myself. And we were catching up, and I told you what we were doing with our retirement as far as advocacy for people to have equitable care and looking at a single payer. And you talked to me about what went on with your husband and what went on with your health insurance for the Affordable Care Act and how you got it changed. Would you explain what happened that day and the next day to us, please?
Yes, well, I've been with my accident. I would say I had a very high deductible and had eaten my way through that, and learning how to negotiate and navigate through the surprise invoices and bills that would come through. And then my husband had been treating some fading eyesight and other issues, but had been misdiagnosed for about 3 years. And also in August, this is my exciting summer last year, he was losing eyesight at a rapid pace within 24 hours. So we scrambled, tried to figure out, found another physician to look at him, found out that he had a very large pituitary tumor, which was, he was becoming blind and probably would have within 24 hours. I didn't know where to turn to. I found used my friend's neurosurgeon, and she directed me towards her hospital in St. Cloud, and we raced him there, snuck him through the ER, because I guess that's what you have to do when somebody needs to get into the hospital fast. And he ended up having 2 neurosurgeries to save his eyesight, and he came through in reasonable health, although he has to be on synthetic hormones and has about 1/3 of his eyesight. When we were trying to determine what to do with the remaining eyesight and whether it would improve or he would be reduced, I took him to I was the only neuro-ophthalmologist that was suggested by everybody who seemed to know anything about eyes. And at this time, I didn't want to risk any misdiagnosis. So without checking to see if it was in our plan or not, I knew I would have no choice. And we raced him to this physician. And when I was talking to Carol, I just mentioned that, wow, we're faced with 2 bills, one for him to assess Brian's eyes, and then 3 months later to reassess and see if there had been any change. And our insurance didn't cover it. And I said, I called, and they said, it's just too bad. We don't cover anything out of network. And I was just pretty much explaining to Carol all the challenges that occurred.
Thank you for sharing that. And it was so exciting because I had told Jan that day that even though it was out of network, he was the only specialist in the state her husband could see. So it was medically necessary, and the insurance company could not deny it. And I said, Keith Ellison, our new Attorney General, is really an advocate for health equity and getting coverage. So that I suggested to her, she called the insurance company and say her nurse friend said that it has to be covered even though it's out of network, because there was no other option in the whole state of Minnesota. And that if they didn't agree to it, that she could appeal to the Attorney General. And Jan called me back because they put her on hold for a few minutes, and they came back and said, well, we're covering this. So that was pretty cool.
Mail order.
Yeah, I was absolutely shocked. And I had to call Carol right away. And all I did was call him and say, hey, I spoke with a customer. She suggested that maybe we might want to take a look at this again before. And I just wanted to ask you before I went to the Attorney General and requested a different view on this. And they didn't take that much time to turn around their ability to pay for those 2 visits.
And that's great for sharing that. And we were going to be showing some slides on resources now for healthcare in America, but one thing I'd like to discuss before we do that, you have said with your small business that if you hire a new employee, tell us what you have to tell them about health insurance benefits, the way it
Oh
stands.
boy, it's probably the first statement I make with any new employee. And I say, hey, if you're looking for full coverage of health care for yourself or your family, we may have to terminate this interview right now because I can contribute to it. I can tell you I have an incredibly high deductible myself, and it is something I just cannot afford to offer you. So if you have it some other way, great, let's move forward. But it could be a deal breaker.
That could, and we will be showing a solution that we can look at together, and you can find out more about that if we all as a nation or state went to this. The other thing I would like to mention is you're an incredibly intelligent woman that has made the most successful mail order ski business in North America that's known to everybody that I talk to. And you have an MBA. And yet this was like confusing to you and wasting so much time. How much time do you think you spent on your husband's appeal? How many hours or phone calls?
It was more fear.
Okay.
I am so busy with the store, and I'm busy with what I can do and trying to make that work and stay afloat. And I just didn't, it was another set of paperwork. I was extremely nervous what was covered, what what wasn't covered. And the ongoing expense in our deductible that we will be facing for the next years to come. And it was just another weight that just pulled me down.
Right, and then you also said with the St. Cloud, you didn't even look for a while to see if
I had about 2 weeks of incredible nervousness till I finally just couldn't sleep until I decided to call and see if it was covered in our network, which I just thank God it was. So it just took a lot of energy, a lot of wasted energy in a sense.
Okay. Well, we'll go through some, we were really glad to help, and let's look at some slides now. So we want to look at our current barriers to healthcare. Right now, it's job dependent. And let's face it, 30 million people have lost a job in the United States in the last 6 weeks, not even in relationship to the statistics before that. So that's a problem. And a lot of it is provided through the employer. And the only way they can get it now in Minnesota, because you did have a window of opportunity until the April deadline, is through the COBRA, which can be awfully enormously expensive. The total annual costs, there's monthly premiums, deductibles, co-pays, out-of-pocket costs. Now we're talking about our current private multi-payer system. There's something that I was going to mention today, and then my husband actually heard it on NPR. The only way you can really have affordable insurance in this country all the way through from birth to death is to be military or government. Now, my husband and I have federal retired through the VA, and actually we don't even joke about it anymore, but we used to say, well, we fight for single payer for everybody else because we don't really need it. But you know, everybody needs that kind of care. The other thing that becomes a barrier is restricted networks for insurance plan coverage, exactly what you were talking about. Want more choices? You must pay higher monthly premiums. And also, sometimes they don't give you another choice outside a network. You just can't do it, or you pay for it out of pocket. And a lot of times when you go to a hospital, that there could be an emergency room doctor, an intensive care doctor that is actually paid for by a different company that you would get billed for because they were out of network. Prescription drug prices, there's been a lot of talk about that, lobbying and escalating costs. Two most well-known drugs right now are insulin and EpiPen. So those are things that we need to look at too, because even if Medicare, we aren't allowed to negotiate for drugs. Only the VA is, and their drug costs are 40% less. My husband and I are both recently retired from the VA, and I'll tell you one thing, I never had a drug company when I was a diabetes nurse at the VA say, oh, I'm not going to help you represent how you're going to get Novo Nordisk or Lantus or whatever the insulin was, because they were making plenty. They had the same situation going on all over Europe. Okay, we'll go on to our next slide. So for a single person, the average deductible in 2019 is $1,396. And look at the increase. So keep going on this. So if employers have more than 35% of employees earning less than 25,000 a year, workers would have to contribute more than 7,000 for a family health plan. So a lot of times they're going without. They just find it as way too much for a family to even contribute or pay for that themselves. And this is mostly, I should say this, where this becomes a real problem is in the states that didn't expand Medicaid. In Minnesota, they could get on Minnesota Care and have that help. When you're so much percentage above the poverty level, you can get on Minnesota Care. But in other states where they didn't expand Medicaid, you can make like $1,000 a month and not get the help. Now we look at all these costs: marketing, advertising, enrolling, disenrolling, negotiating provider fees, executive salaries, profits. We are considered a loss with insurance companies, just as much as if you have a car accident. And I want us to think about this. We all as humans buy health insurance when we're well, whether it's car or a house or health, and then we don't need it until we're sick or we have flooding or a fire or a car accident. So they consider us a loss. Okay, we'll go on to the next slide. So this is really significant. In 2019, 66.5% of personal bankruptcies were because of medical issues. And 75% of these people had some kind of health insurance. So let's go on. Now, Medicare for all. Let's go over the colored blocks here. Covers everyone, universal comprehensive coverage. A single national health insurance plan with everyone having one card for their lifetime. Birth to death, all residents living there. So if you're an undocumented resident, you get it. And it's been proven this helps us all because it's costing us a lot more if somebody goes to the emergency room and they have no health insurance. So it helps the middle person too. Free choice of providers. There's no longer in-network, out-of-network. There's global budgets. There's fee-for-service. People are paid a negotiated salary and negotiated global budget. Ban on profit healthcare providers. Now, there can be an extra insurance for that, but it wouldn't be paid for the public insurance plan. And those are for like the for-profit hospitals and things that are around. No out-of-pocket payments, co-payments, or deductibles. We talked about the global budgets, public accountability, not corporate dictates, protection of the rights of healthcare and insurance workers. Okay, go on, next slide. So single payer means one payment. Single payer universal care, it's just better. Business people, income-based, government funding, public health insurance plan, you get a card, doctor's office and hospital, and then this is before Medicare age. People with Medicare already have this card, but then what would happen is with the improvement is we would no longer have this BDC. It would be one card, all prescription drugs. Everything happens when you go to the hospital or need extra services that are normally that supplement. It would be all one. And so that means business and residents pay affordable premiums to the government. Actually, 95% of the people pay less. The government funds a public health insurance plan, which reimburses doctors and hospitals for care providers. No more bills. Jan, you wouldn't get another bill. Now, there would be a revenue bill, but it would no longer be an expense that businesses would have, because it would be every person according to their income pays that revenue. So it's no longer saddled with something that happened in World War II to give people a benefit when they couldn't give them a raise in salary. Okay, let's go on to the next slide. So let's talk about the Minnesota Health Plan. Some people are aware of this, some people are not, but it's something proposed by Senator John Marty that is looking for a fund analysis, single unified statewide plan. We can just keep going through all the bullets and I'll quit. Covers every Minnesotan for all medical needs, comprehensive medical, dental, prescription drugs, mental health, chemical deficiency, medical equipment, and supplies. Now, if we would get this passed, it would be for everybody in the state of Minnesota. So if you were visiting from Wisconsin, the hospitals and clinics would still receive and accept that insurance payment for that service. But if you're a Minnesotan, then you would get all your care provided by this simple plan. And everybody would be in network. Nobody would be out of network. So if you were going to Health Partners, Fairview, Alina, any of the ones that are out there now, it used to be Health East, but Fairview bought out Health East. So that you would go to those clinics and hospitals and it would be all covered. You wouldn't ever have to worry again, Jan, about, oh, I needed this specialist. Oh, I had this back accident. Is this doctor that treated me orthopedically for my broken leg, is he in network? It's all in network. Okay, so we can go on. All right, so then as we went through these little explanation of that, when we go through again, how do you feel, Jan? Would you be willing to learn more about what we just talked about, how a single payer system could help your business or you personally?
It's certainly broken now. I mean, because like I mentioned to you, I went along for a large part of my life paying Blue Cross Blue Shield on a monthly basis, never using them. And then I have to say with Obamacare, they said you can keep your insurance, and absolutely no, we couldn't. It was just taken away from us instantly like that. So it's from a small business standpoint, it doesn't work. It doesn't work for me trying to provide it to my employees. It's a massive deductible for us. I feel like it's almost a penalty for having a small business. And it is very confusing when you're in it because you're trying to keep your business going, you're trying to keep your health going, and you're not sure where you can go. You don't have the time to do the research once you are injured.
That's a time drain. And you know, when you said that, at first I was so excited about Affordable Care Act because as a nurse, I always want people to have better coverage. And we did cover more people. But you know exactly what you're saying is what convinced me to be a single payer advocate. And I wouldn't expect anybody the first time they hear about it, say, jump in 100%, I'm immersed in it. Because intelligent people, we want to find out what it's about. And I was concerned because I ran into so many people like you that fell through the cracks. They still had high out-of-pocket costs. They still had high deductibles. They actually got canceled from coming to see me and the endocrinologists at the clinics I was working at because of the Affordable Care Act. And that enrolling and disenrolling, they were told that just because of a new contract, they were going to get canceled. So we want to also then transition into what you think this next year will look like with COVID-19 with competitive sports. Like we think of the Minneapolis YWCA Triathlon, the Berkey, which I am going to sign up for the Prince Hawk and we'll see what happens. But
back to sports, it's what I do know.
Yeah, back to sports,
it's very challenging. As far as I know it now, any activities of which one of them is the American Birkebeiner because I'm on the board and I'm seeing how they're trying to prepare for next year. But any activities over 1,000 participants will most likely not be structured the way we are used to it, if they even happen at all. My Ironman Wisconsin was rolled into this year, and I'm not quite sure they can have it even in September because it requires over 2,000 people participating from all over the U.S. So we will, we're all adjusting. We have to stay positive. We have to figure out how to make it work. We've got all different ways in which these events can happen. The American Birkebeiner it will definitely go on, but it may happen over a stage of a week or two where we all ski at our leisure and our free time and ski the course and record the time. We just don't know. So it's just time to stay positive and be flexible with new options.
maybe then if I do the Prince Hawk, and I won't be doing it with all those middle schoolers that are just so over enthusiastic with their poles.
It's so great to see anybody do, whether it's the Prince Hawk and the 10K, the Guadalupe, the ski joring, which I do a lot of. It's just a fun